Good morning. Thursday the 20th of April 2023. It's now 2.5 weeks since I've had my operation, my prostatectomy. A couple of days ago, it's now Thursday, and on Tuesday I had my catheter removed at last. The catheter was a bit of a pain actually. It's 24-hour surveillance. Excuse me. All the time, you're just hoping not to yank it, and yeah, I say a couple of blockages, a couple of revisits to the hospital. I was just glad that the day come when we had it removed. So 8:30 appointment at the Norfolk and Norwich Hospital. We signed in, got took in at 8:40, and the lady explained what she was going to do and what's going to happen after that. So it took about 3 seconds for it to come out. It wasn't pleasant, but it didn't hurt. It was just uncomfortable, and it was a relief when it did come out, believe me. She told me to go and sit in the waiting room for however long it took to be able to wee. So in the waiting room you have little plastic white cups where you just kept drinking water. I had some friends who I knew had the operation the same day as me. They were also in there, same appointment and everything. And after 2 or 3 glasses or cups, they were ready, had the urge to have a wee, and they went back inside and got released. So 2.5 hours later, I was beginning to worry that the water wasn't coming through and I was not going to wee. And she did say to me, if you can't wee, then the catheter goes back in. So I just sat there till 6 o'clock in the evening time and just made sure I did have a wee. But 11:15, and I got the urge, so I thought, well, I'll go in and see her. And you go into a little room and you have to sort of wee into some contraption which collects it, it measures it, and it also shows your flow rate, and that all get printed out onto a little piece of paper for her. And she said yes or no whether you can go or not. If you haven't got enough wee, then you have to wait and go again, but there was enough there. She said it all looked good. Very minimum leakage, which is the main problem after the surgery, which a lot of people get. A lot of people leak for a long time. So what she said to me was to wear either a pull-up or a pad down there for the next few days and then go from there. But she said, you know, your leakage is very good, and hopefully within a few days it'll be 0, which very happy with that. So we were released and came home, and everything's been absolutely fine, to be honest. It's now we're now Thursday, day 3 after the catheter comes out, and to be fair, I feel very good actually. Out of 10, 9. The wounds are still a little bit sore on the stomach, which will take a little while to properly heal and go, but they're just a little bit tender more than anything. They don't hurt, they're just tender. The toilet is, I get the urge, which again I was a bit worried that I was not going to have the urge to be able to go and hold it in, but I do. The brain gets the signal and you go as normal, and the flow is good, and very happy. I didn't expect to be this good, to be honest, so very happy with that. I know everyone's different, so this is my journey. For me saying that people won't have leakages, you will. Everyone is different. It all depends what they've took away, and yeah, so for my journey it's been perfect. Overnight still go 11 o'clock in the evening time and say 5 o'clock in the morning, but no issues with that at all. Absolutely no issues. So the tips with everything with the catheter is that don't make the mistake I made. I didn't drink enough. I know I got wrong, as I said before. I got wrong from the nurse when I went in to have the catheter out. She said, "You're not drinking enough. I can tell by the colour. You've got a dark orange colour, and it shouldn't be dark orange." So she tells you off. She said, you need to drink a little bit more. So drink as much as you can. She was telling me 2 to 3 litres. I wasn't doing 2 to 3 litres. Probably doing a litre and a half a day. But I wasn't doing the 2 to 3 they were saying, and there is a reason why. So really do put the fluids into you, whether it be water, squash, teas or coffee. Just get it flushed through. Also, I done beforehand, you read a lot of these things about the pelvic floor exercises and the Kegels exercises, and you can do them sitting in your chair. It really is nothing, but it does. I done it before 3, 4, 5 times a day. It really is nothing. Just sitting there and holding things in for 10 seconds. It really is nothing. So again, I done them before, and all I can say is my post-surgery is good. I put it down to doing a bit of prep work before the surgery. So again, do what they say in the book. Try and just prepare yourself for after surgery, it's worked for me. So at the minute I'm pretty good actually. I've got another week off work just to make sure everything's okay. Wounds are still healing inside. The nurse did say to me just to be careful, and she said I wasn't to drive, not insured to drive, but sometimes you have to because of different circumstances and situations. But I'm not driving far. It's just from here to there, just to sort a few different appointments out. So again, all in all, I'm probably 9 out of 10. I'm now 2.5 weeks from surgery and feeling good. Again, I started doing these videos just to try and help anybody who's going to go through it, or just to follow my journey. And I've had people who have watched my little channel. Yes, I haven't got thousands and thousands of views, but I'm not interested in the thousands and thousands. I'm just, as I said to my mate Rick this morning, if I can help one person, just one person, to either get tested or just to help them go through what I've gone through, then that's my job done. I'm not in it for glory. I'm not in it for attention. I'm just helping it. It's my journey. And I know lots of people at work who have commented, and lots of people in my Bowles family also commented saying that they've been watching them, and so we're probably getting 100 views, which I'm more than happy with that. I've had some people actually private message me from the US, from Malaysia, from New Zealand, to say that they've seen the YouTube video, and thank you very much for private message me, and they've said they found it interesting, of a real life situation. So this will be my last video for a little while. So it's now a couple of days after the catheter out. So hopefully nothing will change within the next few weeks. And I'll probably do one in about a month's time. So we're not quite out the woods yet. We've got to do another PSA blood test on the 19th of May. That then hopefully should come back undetected. It'll be 6 weeks after the operation, and hopefully the doctor will report that the prostate is gone and everything's gone with it. Then we have a follow-up surgeon phone call on the 22nd of May, and he'll go through the pathology report of the prostate that's got sent away. And again, I'm hoping that it comes back good, and that hopefully this should be the end of it. We'll have regular blood tests at the GP, probably every 3 months for the next year, and then probably 6 months, and then go from there. So happy where I am at the minute, feeling good, feeling positive. So again, thank you very much all for watching my little videos. It's helped me just get through the last couple of weeks trying to do these little videos to push out there. So thanks all for watching, and we'll see you soon. Thank you.